Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related to general medicine, pernicious anemia. Before going to topic outline, if you want to watch the same lecture in Urdu, Hindi, I already upload the same lecture on my YouTube channel. Go and watch that lecture. But if you want to watch in English language, then this lecture is for you. Now come to the topic outline. Today we study definition, causes, pathophysiology, clinical feature, investigation and management of pernicious anemia. First, definition. Basically, pernicious anemia is a megaloblastic anemia in which there is impaired uptake of vitamin B12. From GIT to blood, there will be impaired uptake of vitamin B12 due to lack of intrinsic factor. Why? Because intrinsic factor are produced from gastric lining parietal cell and responsible for absorption of vitamin B12 from GIT to blood. Definition. Amegaloblastic anemia in which there is impaired uptake of vitamin B12 due to lack of intrinsic factor produced from gastric lining parietal cells. Now come to causes. There are two main causes of pernicious anemia. Number one, autoantibodies against intrinsic factor. Number two, autoantibody against gastric lining cell, mean against parietal cell. There are two causes. Number one is autoantibodies against intrinsic factor. Number two, autoantibodies against gastric lining cell, mean parietal cell. Again, there will be deficiency of intrinsic factor. First, if antibodies against intrinsic factor, there will be intrinsic factor deficiency. If antibodies against gastric lining cell, there will be also intrinsic factor deficiency. And if antibodies against gastric lining cell, the condition known as chronic atrophic gastritis, means there will be chronic atrophy of gastric lining. Now come to pathophysiology. In pathophysiology, mainly in terminal ileum, vitamin B12 bind with intrinsic factor and absorb from terminal ileum GIT to blood. But if intrinsic factor is not present due to autoantibodies directly against intrinsic factor or autoantibodies against gastric lining cell, mean indirectly, there will be intrinsic factor deficiency. In result, the vitamin B12 will not absorb from GIT to blood. Now, this is basically pathophysiology. When vitamin B12 is not absorbed, and vitamin B12 is responsible for DNA synthesis of RBC, and vitamin B12 responsible for myelin sheath formation of neuron, and vitamin B12 are responsible for production of serotonin. If vitamin B12 is not absorbed from GIT, there will be vitamin B12 deficiency. When there will be vitamin B12 deficiency, then DNA synthesis will be not occur in RBC. In result, there will be no maturation of nucleus of RBC. In result, there will be megaloblast cell production, mean the cell size will be out of control and megaloblast cell will be produced with immature nucleus, and these megaloblast cell will be die before maturation, and in the result there will be anemia. Number two, when vitamin B12 is deficient, then myelin sheath and serotonin will not produce. In the result, there will be depression, dementia, and psychosis. This is the pathophysiology of pernicious anemia. Now come to clinical features. In clinical features, there are two types of symptoms of pernicious anemia. Number one is anemia symptoms. Number two is neurological symptoms. In anemia symptoms, there will be fatigue, glossitis, mean inflammation of tongue, headache, breathlessness, tachycardia, pale skin. And in neurological symptoms, there will be hand and feet neuropathies, mean numbness, and depression, dementia, psychosis. These are the clinical features of pernicious anemia. Now come to investigations. We do basically three types of investigation for pernicious anemia. Number one, CBC, complete blood count. CBC will show macrocytic anemia, mean megaloblast cell, mean macrocyte, mean the mean MCV, mean corpuscular volume of RBC is greater than 95 micron. Second is antibodies level. We will do antibodies level which show antibodies against either intrinsic factor or against gastric lining cell. The third investigation is Schelling test. By Schelling test we measure the vitamin B12 absorption through intestine. Measure intestine vitamin B12 absorption. These are the three investigations of pernicious anemia. Now final is management. Because due to intrinsic factor deficiency, when patient take oral vitamin B12 in the form of enamel product, in the form of food, there will be not absorption from GIT. Then the management is patient should take vitamin B12 for whole life through parenteral route, not oral route, parenteral route. Management is vitamin B12 replacement for whole life through parenteral route. Now today we studied pernicious anemia definition, causes, pathophysiology, clinical feature, investigation, management. Now today our topic is complete. If you like my videos, press the like button and share this video with your friends. And if you new to my channel, subscribe my channel for more videos and press the bell icon to open the all notification in order to you receive each new video notification. For watching my videos, I am very thankful to you. Thank you very much.